Welcome to Donnie Boone. On April 10th, 2020, Governor Greg Abbott announces easing the lockdown for the COVID-19 virus. Then George Floyd is killed May 25th, 2020, and riots ensue. Sunday, May 31st, Governor Greg Abbott has a disaster declaration and activates the Texas National and 1,500 state troopers, which we call Department of Public Safety officers. And then June 25th, Governor Abbott pauses reopening after Corona-19 upticks and gets worse, which is, of course, caused by the riots where over 200,000 people in the United States riot and don't socially distance and don't wear masks. And the problem is that the government, the federal government, when they're keeping these records and compiling the data, refused to ask anyone if they had been in the protests and the rioting and the looting. And so without that data, it doesn't exist. And I suppose when you look down that list and you say, well, what's the number one thing that's causing this uptick in COVID virus? And the only thing that shows up is people who frequent bars. Well, that's wrong, because it should be way down the list, or it should be a distant, far distant number two after engaging in these riots in which people just went hog wild and didn't pay any attention to the COVID-19 virus. Now, June 27th, Governor Abbott closes the bars and river rafting, I guess because you drink beer while you're river rafting. You know, Corona beer obviously causes the coronavirus. And outdoor gatherings over 100 people. And I'm just wondering if that includes rioting. If another riot happens, another protest, and it's over 100 people, will the government shut it down? Will the police start arresting people? I seriously doubt it. But the death rate is dropping. The number of people who are contracting COVID-19 is going up. And the whole point of the lockdown was to try to bend the curve so that the hospitals are not overwhelmed. And as long as the hospitals are within capacity, everything was fine. This falls in line with herd immunity. You want your population to get the virus, and you want them to do it over time, not all at the same time, then heal up from the virus, and then they're inoculated from the virus and they can't get it again, because then your emergency rooms won't be able to keep up. But other than, I think, 2 counties in Texas, everybody else in the whole United States, as far as I know, are well within limits to what their capacity is in intensive care. In fact, I read an article about the Houston hospital system, and they're running 90%. A year ago, they were running 90%. A year before that, they were running 90%. They are running a normal amount. And as long as the death rate drops, we need to go to church. And there are not more deaths related to this, then you're fine. I'm sure that the total number of deaths during this period, that COVID-19 ranks at the bottom. I'm sure that drug overdoses, accidents in the home, car accidents, although there's less driving, these are probably higher than the COVID-19. But how can you get reliable statistics? Because everything's been ruined. The government isn't keeping proper statistics. So, Governor Abbott, why are you going after bars and river rafting and outdoor gatherings? And when are you going to let us go to church? The argument is that the liquor stores are open so addicts can get to their, and that, I guess, abortion clinics are open because people get drunk and get women pregnant. I don't know. I just can't see that somebody sitting in a bar drinking a drink who is social distancing, and before he comes in and after he leaves is wearing a mask, how that could be worse than people burning cop cars and torching the city while elbow to elbow yelling and screaming and beating people down to the ground. I don't see how they're not transmitting the virus. So that's about all I have to say about that. Remember, like and subscribe and share this video. Thanks a lot. See you next time.